thank you for inviting me today. First, let me introduce myself. I've had a rather interesting and for me, very exciting career and life here in beautiful Orange County. Life has been good to me in this community, and I'm glad to be part of something that perhaps can give back. I grew up here. I grew up in Santa Ana. I went to high school there. We played great football back in those days, and went on to Cal State Fullerton and then a career in both government and in business. In government, I was the mayor of Santa Ana for some 8 years and worked on Capitol Hill back in the 80s and had a variety of different opportunities as an elected official to help start the Orange County Transportation Authority, which has rebuilt our freeway system. I was the first chairman of the board of the Toll Road Authority that built the toll roads in South Orange County. And I've been able to serve in a number of public capacities. In business, because I didn't want to have a career just in politics, I went on to become involved in the housing business with my own company, was recruited into the Irvine Company and ended up spending 15 years as the #2 executive to Donald Bren at the Irvine Company, which was an incredible honor and an amazing opportunity to work at the scale that the Irvine Company has created. It's very fun to be in this neighborhood. If you knew Donald Bren's personal history here, it's a very fun thought. So I also serve on the board of directors of Hoag Hospital. And that's really where I started to get introduced to two issues that overlap mightily with each other. One is the issue of mental illness and the other is homelessness. The emergency room at Hoag is getting clobbered by cases of people arriving because they're homeless and the police don't know what to do with them. They don't want to take them to jail. That police officer has the same heart that you do. They want them to be treated humanely. They want to get them help. And jail and the ER are about our only choices. Secondly, we have people living on the street who are suffering from severe mental illness. And they find our way into the emergency room of not just Hoag, but every hospital in this county. From there, I started to work on the issue with Dr. Rick Fable, who had been the CEO of Hoag and then ultimately ran the 6-hospital system here in Orange County. And we began to wonder, what is the system for dealing with mental illness in Orange County? What is the system for dealing with and solving the problem of homelessness in Orange County? The answer we found quickly was no, none. We don't have a broken system. We don't have a weak system. We have no system. We have no system whatsoever. We have programs, we have projects, we have people, and you have several of them in this room, who are literally saints working in this field. Margie Wakeham, Helen Cameron by name. These are people, these are saints working in this system, doing what they can on projects and programs for people on an individual basis. But the fact of the matter is, there's no system. So this is the fourth, as I understand it, in a series of get-togethers to look at the issue of homelessness in Orange County. And since it's the fourth and the last, I am going to tell you a little bit about the business community's potential role in this. But I want to step back and I want to talk to you. I want to make sure that everybody in this room knows that the only way we're going to solve this problem is by establishing a system of care, a system of dealing with this issue. And I'm hoping that you'll be thinking about that in terms of your own personal engagement of this, and you'll be talking about the need for a system. So let me say that system is not a very emotional word. It's not love, it's not respect, it doesn't connote a lot of emotion, but it's fundamentally important. And let me make the point. If I fall over right now and I grab my heart, you're likely to think that I'm having a heart attack. And there isn't a soul in this room that wouldn't reach for their cell phone and dial 911. Thank you. So as a culture and as a community, we made a decision that we are going to have a healthcare system that had an emergency response to it to save lives and raise the healthcare of this community. And it began with 911. Interestingly enough, if you look it up, it started in 1967. So somebody had to be in a room just like this and had to say, we've got people dying who are not getting to the hospital in time. How do we solve it? Build more hospitals? Can't afford it. Well, here's a good idea. Let's give somebody a number to call. 911. But what do we do next? How do we make sure that the responder is close to wherever the problem is? How can we possibly cover that piece of geography? Well, we've got fire stations everywhere. Yeah, but they fight fires. Could we train them as paramedics? Could we not incorporate a second piece of the system so that the response is within 3 to 4 minutes? And when they arrive, could we then use technology to put a bud in their ear so they're already talking to the hospital, getting instructions from a doctor on how to deal with that patient? And can we make sure that that emergency room knows that I'm arriving with my heart attack and that they're there and they can respond to me? That's a system. The doctor is not working for the same employer as the hospital. The hospital is not working for the same employer as the paramedic. The paramedic's not working for the same employer as the person answering the 911 call. But they formed themselves into a system of care. Because society, our society said, we need this. This is something we need and want. And we're willing to pay for it. And we're willing to organize. And by the way, we're going to demand it of government, get it done. And it got done. In a lifetime. Our lifetime. Our lifetime. This happened. So, I wanted to tell you that before I ask the real question today. And that is it possible to end homelessness in Orange County? Wow, tall order. Why don't we just start with reducing it? Why don't we start with coping with it? Why don't we start with punishing it, depending on where you are on the spectrum? No. Why don't we end it? Are we capable of ending it? Is it too big? I remember as a child, my father taking me to see some of his friends that he'd served in World War II with. And they had polio. They were dying. Because when I was a child, polio was an epidemic. It wasn't a problem. It was an epidemic. And how was it solved? Not with a vaccine, yes. It helped. It was solved because society said, we are going to change the way we address this issue. We're going to vaccinate our children. We're going to educate the public. We're going to dedicate ourselves to ending this disease. And in 1994, they declared that polio was eradicated from the United States. Can we do this? Can we do this? So what does it take to get it done? I want to bring you first, middle, and last to a word. Not a sexy word, but a critical word. We need a system. So what would that system consist of? Heather touched on it. First of all, we have to have the right treatment to deal with the underlying causes, which are complicated. Medical, mental, poverty. There's a lot of reasons that people are homeless. Sometimes it's domestic abuse. 2 weeks ago, I was in a shelter, touring the shelter. And Judge Carter, a hero in this play, had demanded that a gymnasium in an old YMCA that had been converted to a shelter be doubled in size to use the gym, which had not been permitted for a shelter, to take the women in that he found in the Civic Center, 57 women living outside in the Civic Center, and put them in that gym. And I went and visited that. It would make you joyful that they were there. It would break your heart to think about where they were the night before. So we need a system. And we need to be able to address people in the street in an appropriate, humane way, coax them into treatment, find good shelter for them. From shelter, we need to get them into treatment centers. Those treatment centers are being designed today. I want to compliment the county. They bought a building called 265 South Anita in Orange. It's going to be about 50,000 feet, and it's going to be surrounded with the notion of whole person care. So when you walk through that door, whether it's mental illness or homelessness, you don't have to leave. We're not going to send you off in appointments. We're actually going to treat you, help you, direct you, take care of you, hug you, right in that building. We need about 3 of them to build a system out in Orange County. So we need to double the amount of shelter space. We need to put mobile teams in each region of the county reaching out to the homeless. We need to be able to, and mentally ill, and we need to be able to take them to these treatment centers where they can get professional help, whole person help. Typically, somebody who is homeless or mentally ill doesn't have one thing going on. They could have medical issues as well. We need to have everything at one place. From there, we need the next tier in the system. The third tier in the system is we need transitional housing. We need a place for people to go to rest, recuperate, and get ready to get on with their lives. We have about 10% of what we need currently. From there, then we need permanent supportive housing. And I would say Heather, as CEO of the Association of Cities, has been heroic in putting together a plan. She was very bright and cheery about it. I know what her week's like. The pushback. Why are we doing this? It's not our responsibility. The county failed. Go talk to them. They're sitting on money that should be spent on this. Don't put me through that. Those hearings are going to be ugly. She's pushed and pushed and pushed and pushed. And I think we're going to get 2,700 units of permanent supportive housing. And it will be a critical piece of the back end of what this system is. So we've got tiers: the street, shelter, treatment, recuperation, permanent supportive housing. If we wrap that in technology, if we get all of the groups of expertise communicating with each other, if we make this patient-centric as opposed to program-centric and link it all together, we now have a system. The system you expect when you walk into Hoag Hospital. When you walk into Hoag Hospital and we find there's a second thing wrong with you, we don't send you to the parking lot. We bring in the doctor who can take care of the second condition. That's what we need. There are a few of us who are working on that system right now that I just described. It needs to be something you advocate. So let's have a fun moment, and let's decide that we can look a few days into the future. I'm talking days at my age, not years. And the system's in place, and we're proud of it. It's world class. It works. There's no one living on the street anymore. We have a place for them, and we have a place to make them healthy and whole and vibrant again. So let's assume that we've arrived at that place. We're still not there yet. There's one other thing we need. And that is, for people to thrive, they need community. They need to be part of something. Much of what troubles the people who are homeless is a desperate loneliness out of circumstances that they control or they can't control. And the faith community has the ultimate responsibility. Within our community, they can be the hand that reaches out during this critical period of time and can help them to restore their lives, to make them meaningful, accepted, loved, welcomed members of the community. That is the role of the faith community. Yes, advocate for the pieces of the system. Yes, get these politicians to have a little bit of courage and take on a tough hearing. But when we're done and the system's in place, then the job is to minister. And I think there are many churches that do a beautiful job of that. We need more. The business community is going to be involved, is involved. We're looking at means by which we can finance these facilities. Sometimes it's going to take charity. Sometimes it's going to take a loan at favorable terms. Sometimes it's just going to take business expertise in how to design a system and get it implemented. So what does all this cost? As a business guy, that's my question. What does all this cost? It's about $1.5 billion. Now, if you think that's a lot of money, it's not. If you think that we need to go find it, it's here. If we get our fair share of monies that are available, we don't need to raise taxes to do this. If we're willing to coordinate the programs and coordinate the expenditure of the dollars, we can make this happen with the money we have. We cannot randomly spend this money out in the community as we have and waste it. We have to pull it together into a system. The money exists. We have to force that notion on those that are playing in this field now and doing good things, but force the system to come out of it. From those efficiencies, you will get more care, more coordinated care, and better outcomes. The business community is and will be involved in every single level of that. And I will say to you finally that in the healthcare community, what's really exciting is the medical community has engaged in dealing with issues of mental illness. We have a mental health coalition now. There's 65 organizations that have come together to design a world-class, not a good one, not an okay one, not one better than the one next door, a world-class system of care for mental illness. That gets married with this issue of homelessness, and we have a place to go, and we have a direction and a strategy to go. Happy to answer any questions. Thank you.
Dan, thank you. That was one of the more comprehensive presentations I've heard in a long time, and I really appreciate that. Since we are made up of folks who, some of whom represent the faith community, some are leaders in the faith community, but some are members of the business community as well, I want to ask you a business community question. When you look at the cost study, it makes a very compelling case, particularly with the aggregate numbers, that simply cost-wise, it makes more sense for us to invest in housing than it does to continue the way we've been going. So it's a strong argument for the system. But that's true with the aggregate numbers. It'd be simple for a business or a group of businesses to feel like, well, Hogue is absorbing a lot of it, some of the other organizations, but it's not costing me a whole lot. How do we advocate within the companies where we work that we should be more involved and supportive of this effort? Give us some elevator speeches that we can take and use to advocate there.
So let me give you a couple. First of all, when you have an employment force that is healthy, not just from a medical point of view, but mental health point of view, and when there's a place to go to deal with those things, you have a much more productive workforce, number one. People show up, they show up ready to work, and they're more productive. And companies today are highly focused on this because they lose a lot of productivity to these issues. Secondly, we still have a system of healthcare in this country where the employer pays, arranges for, and pays part of the health insurance that you have. And the costs are running through the roof So employers now are looking at how do we get on the preventative side of this? How do we become part of a better system so that we can lower costs on a purely business basis? So productivity increases with a system that I've just described. Costs for insurance go down. I will tell you, it's really rather remarkable within our mental health coalition that the insurance companies have showed up. They're in the room with us. They know that if we can solve this, we can actually reduce costs. That cuts to the bottom line of a company. So I think that there are ways in which we can do this. And I want to give you one other example. There's a term that passes around healthcare, and my dear friend John in the back knows all about this, called $1 Million Monty. Okay? So $1 Million Monty is somebody who's got a series of chronic conditions. And he goes into the ER because chronic condition number 1 flares up, and there's about a $50,000 event that comes out of that. He's back out, doesn't take care of the situation. He's back in 3 months later for chronic condition number 2, and that was $150,000. The next thing you know, it's costing us $1 million a year to deal with $1 Million Monty. So the St. Joseph healthcare system, St. Joseph Hospital, worked with CalOptima, an insurance provider under Medi-Cal in this county, to say, why don't we take the most expensive cases in the county that are chronic, the most expensive ones, and let's focus right down on that patient and say, how do we take better care of you? It is incredible. $1 Million Monty is dropping around 100 grand. Just by putting together whole person health, patient-centric system. So there's demonstrations going on today that will yield methods of care that are better, dramatically less expensive, that the business community will rally around. And I also think one other thing, I've yet to go anywhere within the business community, where at the end of a talk like this, I don't get somebody walking up, and it's usually more than one, and sometimes there aren't many because they only want to talk to me alone. And they're rich, they're powerful, and they whisper to me, I lost my son. He committed suicide. My life ended 3 years ago. I'm just functioning. I didn't know what to do then, and I'm frustrated I don't know what to do now with my grief. How can I help? So within the business community, if we present them an opportunity to participate, I can guarantee you they will.
Thank you.